Yeah, I'm good.
We're recording.
All right. So, I'm going to run through those tests one more time for the video. So this is for the cervical spine. Rob, why don't you take your head forward, try and touch your chin to your chest. Lexion, how about you look back towards the ceiling? Extension. Can you look over your shoulder this way? Right rotation. How about this way? Left rotation. You can look forward. Can you try and touch your ear to your right shoulder? Right lateral flexion. And in the other direction, left lateral flexion. Great. Okay. So assuming maybe Rob has some pain coming off his right side, we're going to do the maximal foraminal compression test on that ipsilateral side. So I'm going to rotate his head towards that side, maybe laterally flex a little bit. Rob, let me know if this feels better, worse, about the same. I'm going to add a little increasing downward pressure. Rob, how are you feeling?
About the same.
Good. So a positive would be increasing pain of a radicular nature down that right side. Next test is foraminal distraction or traction. I'm just going to put my thumbs underneath the occiput, hands, my fingertips near his temporal crest line, and I'm just going to add increasing traction pressure. Rob, does this feel better, worse, about the same?
About the same.
So this would be positive. If he had neck or arm pain or both, and we did that and he felt better, that would be a positive for that, relieving intraforaminal pressure. Next one is the Valsalva sign. Maybe in my history with Rob, I just want to see if he has any pain with coughing, going to the bathroom, straining when going to the bathroom, sneezing, laughing. All of those are increasing that intra-abdominal and intrathecal pressure and could be indicative of more severe spinal injury, strain, something along those lines. How am I looking?
Awesome.
Great. Okay. Rust sign. So you want to demonstrate rust sign for us? Rust sign. This is Bacody's sign, which is great too. We'll jump to Bacody. So Bacody's, we're taking pressure off of his lower cervical nerve roots, right? When his arm is dangling, there's just some pressure. So if there's an irritated nerve root, C5, 6, 7, 8, T1, you know, he may have a tendency to want to raise his shoulder up or get some relief in this position. This is Bacody's sign. Rust sign is he's maybe coming in holding his neck, and when he has to move or lay down, he's really supporting his neck in all these different maneuvers. Again, more indicative of a severe strain, maybe a fracture, dislocation, something serious. And the next three are for lower cervical nerve root irritation and or plexitis. So the first one is Bacody's sign. That was the one we just showed you. So maybe get some relief with a lower nerve root irritation. We could also expose here. We have the clavicle, the trap, the sternocleidomastoid. We have a soft, squishy area right here. And that's where those nerve roots are most exposed, or the plexus nerve. So we're going to add a rapid thump in that area, looking for an electrical sensation, increased pain, maybe going down his arm. Any pain there?
Yeah.
It actually does hurt Rob. So trying to get to the root of that, the nerve root of that. All right, and figure that out. But he got a zing when we're doing that. So those nerves are very superficial. If they're inflamed, much more likely to get a zing. But it could be normal on Rob too. Next, we're going to do the brachial plexus stretch test. If he has pain on the right side, right arm, I'm going to take his head, trying to go kind of stretch back into the other direction. This hand's holding his shoulder down, and I'm stretching that brachial plexus. Again, looking for irritation in his neck, electrical in nature. Anything there, Rob?
Just muscular.
And yeah, so he differentiated, hey, we're stretching these muscles. They may be tight muscles, but that's not really what we're looking for with the brachial plexus stretch test. We're looking for more of an electrical increased pain down his arm. All right.
All right.
Nice. All right.